Whenever surgery is recommended, it's important to do one's research to be comfortable with the decision to have surgery, which is a major life decision. Often investigating, reading, and asking can be very helpful in educating oneself to be comfortable about a decision to have surgery. When you're still not sure, or when it is a very major operation with potentially life-threatening or life-changing implications, then in general, it's probably a good idea to get a second opinion. It's usually covered by most insurance companies, and don't worry about offending the surgeon by getting a second opinion. I've had over many years, many patients, if not most, who are getting second opinions who come back to me. Some don't, which is fine. I want patients to be happy and satisfied with their decision. If your surgeon is unhappy that you will be seeking a second opinion, then you probably should go and get a second opinion also.